This week, the Red Cross was called in to support CHEO due to an unprecedented surge of patients. Bringing in the Red Cross should only be a last resort used for unexpected emergency situations. Why didn't this government proactively support and staff children's hospitals in the summer and early fall when healthcare workers first sounded the alarm about the crisis in pediatric hospitals?
Minister of Health.
Thank you, Speaker. I'm going to quote the Chief Nursing Executive at CHEO, who said, "It's been all hands on deck at CHEO this viral season, as we have responded to unprecedented volumes due to RSV, flu and COVID." It is not lost on our government that in the last month alone, CHEO has essentially doubled their pediatric ICU unit. It is an incredible amount of work that they've been able to do very quickly. We have now permanently made the investment to ensure that those pediatric beds will stay at CHEO, because we know that that hospital in particular, because of its large catchment area, has many, many community hospitals that they are serving. They are doing that with a minimum amount of help from the Red Cross. They are partnering with the Red Cross to return the staff who have been redeployed and working in those pediatric ICU units to make sure that they can go back to doing their important work. Thank you.
Supplementary question.
Again to the Minister, what should have been part of this government's plan all along was a plan to address the root cause of our healthcare crisis, that's staffing issues. This government can take a tangible action right now to retain healthcare workers. Will the government commit to not appealing Bill 124?
President of the Treasury Board.
Thank you very much, Mr. Speaker. As the member knows, and as the AG has stated, we're reviewing the decision and we intend to appeal it. But we will speak to the investments that we have made into the healthcare system. Over the past year alone, we've increased base spending in healthcare by over $5.2 billion. That is the largest year-over-year increase in the history of this province. When we look at health human resources across this province, we have put in place the investments to support the hiring of over 14,500 net new nurses. That is unprecedented in the history of this province, and we will continue to make those investments, as we have with 2 new medical schools that we are announcing in this province, in Brampton and Scarborough, making sure we have new medical doctors in the north through that. So, Mr. Speaker, the members opposite have voted against each of those measures, have voted against every single increase to healthcare spending on this side of the House, and with our members opposite, we will continue to make sure we make those investments.
Thank you. Thank you. Final supplementary.
Speaker, they can say whatever they want. They're failing. We've got a crisis. They didn't prepare for it. And we're seeing the consequences of this government's inaction in our hospitals every day. Yesterday, it was a family in Eastern Ontario who struggled to find a hospital that could accept them for labour and delivery. First, they tried their local hospital, but the birthing centre was closed due to staffing shortages. The next hospital they tried didn't have room. So finally, they returned to their local hospital. That situation should never have happened. The mom, Kendra, said this afterwards, quote, "I'm just afraid that the healthcare will fail me again, fail my son." What does the minister have to say to parents like Kendra who are scared for the future of our healthcare system?
Minister of Health.
Thank you, Speaker. What I will say to the people of Ontario is that we are fixing a healthcare system that was woefully ignored by the previous Liberal government. The former Premier, Kathleen Wynne, admitted publicly that she should not have cut those 50 doctor spaces that they did to assist in their healthcare crisis. We are making the investments. Some of them are already, we're seeing additional health human resources in our communities, over 12,000 new health human resources who are working out in our communities, in our hospitals, in our long-term care homes. We're continuing to do that work by increasing residency spots, by increasing access, ensuring that young people who want to choose a career in healthcare have those options, and in many cases, nurses and PSWs in particular are getting that opportunity community with assistance financially from our government. We'll make the investments, we'll continue to do the work, but frankly, we were left with a system that had been ignored for far too long.